This portion of exercise 12 deals with the muscles of the head, the neck, and the trunk. So you'll notice how we have separated out the muscles into three different PowerPoint sections according to where the muscles are located in the body. So we start first with the muscles of the head. They're going to be organized into different groups. Some of the muscles enable you to form your different facial expressions, as that nonverbal communication that's so important. Some of the muscles allow us to chew food. This is known as mastication, is the process of chewing. You have extrinsic eye muscles that help control the movement of the eyes, left to right, top to bottom. There are also extrinsic tongue muscles that help to move the tongue, that allow you to speak. These are voluntary movements of the tongue. And the muscles of the pharynx that assist with swallowing. Those muscles that are used for facial expressions are located deep to the skin on the face, neck, and scalp. Most of them will originate on a bone and insert into the skin. So that way, when the muscle contracts, you actually see that facial movement. So if we look at several of these, starting with occipital frontalis, has a frontal belly that helps to raise the eyebrows, kind of wrinkles that forehead. And the occipital belly, which is going to be towards the back then, is going to kind of wrinkle the skin on the posterior surface of the neck. And so what you're looking at is highlighted in the boxes, but is all along this area here. So you've got the frontal belly here, the occipital belly here. Obviously, the names are for the location of them. Orbicularis oculi. Oculi, remember, refers to eye. And so this is going to help close the eyelid. When you're squinting, when you're blinking, this is the muscle that's going to be involved. Orbicularis oris is now going to be referring to the mouth. It's closing and protruding the lips when you're speaking, kissing, whistling, any of that type of movement. The buccinator muscle, it's going to compress that cheek while you're whistling or while you're blowing. Zygomaticus helps to raise the upper lip and the lateral corner of the mouth. So like when you smile, this will be the muscle involved. Depressor angular oris depresses the angle of the mouth. Platysma tenses the skin on the neck and also helps to lower the mandible. You can see here it is this very large muscle along here. For chewing, which is mastication, there's 4 muscles that are involved with chewing. You only have to know 2 of them. They do act on the TMJ, which is the temporal mandibular joint. It helps to elevate and depress, protract, and retract that mandible, the lower jaw. Move it to allow for that chewing process to occur. So you have the masseter, which is this muscle right in here. That's going to help to close the jaw, helps to protrude the mandible. And your temporalis actually also helps to elevate the mandible to close the jaw. This is right here, and then retrudes the mandible. Pull you back. Muscles of the neck and trunk. The sternocleidomastoid is involved with flexion and lateral flexion of the neck, helps to rotate the head so that the neck or the face is turned superiorly into the opposite side. As you can see, it is located right here. The trapezius, as you can see here, elevates, retracts, and depresses the scapula. So it's located right here above the scapula. Excuse me. The levator scapula raises its scapula, inferior rotates it, kind of those movements you see when you're shrugging your shoulders. So this would be the muscle right here. Pectoralis major is involved with flexion, medial rotation, and adduction of the arm. As you can see, it is highlighted. And then the pectoralis minor is involved with depression and inferior rotation of the scapula. You notice that muscle, certainly there's a layering effect. So here's the pectoralis major, and deep to that would be the pectoralis minor. Serratus anterior is involved with protraction and superior rotation of the scapula. It helps to hold that scapula against the thoracic wall, helps to hold it in place. The deltoid, this is the prime mover of shoulder abduction. It's also going to be assisting with flexion of the shoulder, extension, rotation, and abduction. The teres major is involved with extension, adduction, and medial rotation of the arm. The latissimus dorsi, this is this large muscle here. It's the prime mover of the arm extension, adducts and medial rotates the arm. The rhomboids helps to elevate the scapula. It will work with the pectoralis minor to rotate the scapula inferiorly and helps to retract the scapula. And then your external intercostals. Once again, costal refers to ribs, so think of that. That's going to get you in the right location. The external intercostals are involved with inspiration. When you inhale, it's going to help to elevate or move this rib cage up and out. That's going to increase the volume of the thoracic cavity to allow you to inhale. Excuse me. In terms of trying to keep some of these straight, look at the direction of which the muscle fibers are going to distinguish between, say, the external intercostals and the internal intercostal muscles. Notice there's a difference in the direction. Also, once again, get your landmark and move from that landmark with the neck muscles. Oftentimes it's find your landmark and then not necessarily moving to the right or left, but superior and moving deeper from there. It just takes practice and time, that repetition. Once again, whether you are using drawings and labeling them or coloring them, whether you use an anatomy coloring book or go to Google Images and print off your own pictures and just label drawings, whatever works best for you, just that repetition is going to help you to learn the muscles. And then as you can see here, the intercostal muscles. As we continue on, you have the rotator cuff. This is it's a group of 4 muscles. They help to stabilize that shoulder. So the muscles that are involved collectively and known as the rotator cuff, subscapularis, supraspinatus, infraspinatus, and teres minor. So these 4 will work together. So subscapularis is going to be involved with adduction and medial rotation. Once again, it's helping to stabilize that shoulder. As you can see here, it is diagrammed. The supraspinatus is involved with abduction of the arm. Infraspinatus is going to help with lateral rotation of the arm. We're all talking about the arm. And then the teres minor is also with lateral rotation of the arm. So you can see here, teres minor is right here below the infraspinatus. So once again, get your landmark and move down. So you've got your supraspinatus, then below the clavicle, and all this is below. Here's the clavicle point of reference. Here's the spine of the scapula. So below the spine is going to be the infraspinatus, and then your teres minor below that. We look at the abdominal muscles. Once again, look at the direction that the muscle fibers are oriented to help you keep straight and distinguish between them. The rectus abdominis, excuse me, is involved with flexion of the vertebral column, helps to stabilize your pelvis while you're walking, and it also assists you when you're forcefully exhaling. So here's the rectus abdominis here. The marking right here, the linea albus, the white marking right here, and then the tendinous and scriptus are these, they look like these parallel white lines across this way. The external obliques are involved with rotation and lateral flexion of the trunk. Look once again at the direction of the way the fibers are moving, almost like from the side downward towards the pubic area. Now the internal obliques are going to be with rotation and lateral flexion of the trunk. But notice the difference now. It's going, think of kind of by your hip, your pelvic bone right there, but it's moving upwards towards the midline. So the external obliques, number one, are going to be more superficial to the internal obliques. The name would imply that. And then, but also it's like you peel one layer away at a time. And the internal obliques, once again, the direction of the fibers are a different orientation. And then deep to the internal obliques, pull another layer out, you've got the transversus abdominis, which now pretty much just kind of going parallel to the ground.